Oregon actually is the leader in using nurses in primary care, in independent practices, in group practices. And so in some ways, the report says the rest of the country should look to Oregon. It's so recession-proof that it was difficult for us to pin down the issue of whether there's a shortage of nurses. We know there's going to be in the future, but so many people who kept their license came back to nursing during the economic downturn that this country is not recruiting foreign nurses or temp nurses as it did as little as 5 years ago, because Americans basically went back to nursing. Now, whether that will sustain itself, it means that we have to continue to train nurses, and the report suggests at a much higher level than we did before. The report basically is in the context of healthcare reform. We're going to put 32 million people into the healthcare system, and we're going to have to find a way to provide them with access to healthcare. Nurses are the key to that. In fact, nurses are the key to quality healthcare in the future. They're the group that is going to make the healthcare system seamless, improve its safety, and improve its outcomes, and improve the access. I think that as Americans get used to the transition we're going to go through, you'll see nursing playing a greater role in primary care, in chronic care management, in end-of-life care, but also in terms of leading healthcare in this country. One of the things that the report is very clear about is that nurses must be at the table. As we design these new delivery systems, as we increase patient safety, we need to make certain that nurses are everywhere, in particular in leadership positions, as partners to the other leaders in healthcare. There's a role for nursing in every part, and for nursing leadership in every part of the healthcare system. The training of nurses, the research in nursing is patient-centered. It has a whole different approach. We need to move away from our fee-for-service system in the United States, where we pay on the basis of everything that's done to the patient, every procedure, every medical device, and move to a much more integrated system. There's a big role for nursing in developing that integrated system and playing critical roles at critical places in that system. Well, healthcare costs are high first because we have a system that incentivizes the healthcare system to do more to the patient, to give them more tests, to use medical, give them more medical devices, to send them around to a variety of specialists, because they get paid on the basis of doing more to the patient. The economic incentives should run the other way, towards outcomes. Not just, and in the process, by making the healthcare system more integrated, more seamless, there's a very important role for nursing. More importantly, nurses have to be at the table when you design that system. But we've got to flip the system on its ear if we're going to control healthcare costs. And we've got to make tough-minded decisions about technology, about the appropriateness of technology, about drugs and the appropriateness of drugs. We've got to move to more generics as part of the process. But more than anything else, we've got to integrate the healthcare system so it's seamless. Much of our costs are in chronic care, in people that have chronic illnesses. Some of our costs are in things like obesity and the associated illnesses. If we could get Americans to eat right, not to smoke, and to exercise, we would drive down healthcare costs in this country.